Robert Garrison. I'm a general dentist here in Columbus, Ohio, and the subject of this video is deep cleaning. If you have been told that you have deep cleaning, that means that in at least one place in your mouth you have a gum disease starting. Both forms of this gum disease are caused by the bacteria that live in your mouth. At this time, there are usually about 450 different kinds of bacteria living there at any one time, and approximately 4.5 billion of them. Personally, I think that's kind of gross, but they are there. Now, once they get down into that little pocket along your gum, the place where you like to stick popcorn most of the time, and they start to get things infected, it gets to the point where your brush can't reach them, and your floss won't reach them either, at which point now you need help from the dental office and your dental hygienist. Our job at that point is to go down and clean a lot of those areas out, the stuff that's stuck on there. That's what's called the scaling and root planing. Now, those 4.5 billion bacteria like to live on your mouth. They like to make a sticky little film, and that's how they stay on top of your teeth and don't get washed away. So once they stick on there, if you remember that little red stuff that you had in grade school that you took, that's the stuff we're looking at. Those bacteria like to stick on your teeth, and they start working their way down into that little crevice along your gum, which is where you like to stick popcorn most of the time. Once they get down in there, they start getting an infection process going, and your body starts reacting, and your gums start to react, and they start to get red and puffy, and they start to stick farther on your teeth, and they keep working their way down in farther. When they get onto the roots, that's when we start to get into the scaling and root planing or deep cleaning. That's when we go down and we have to clean all those little deposits off. Some of them get to be mineralized, and they start to look, if you look at them under a microscope, they're like an English muffin, all little nooks and crannies full of little bacteria living there. So the first step is to remove all of that stuff. After that, we do a number of different treatments. We're going to try to make life as miserable as possible for those little bacteria, because they don't all go away, and we can't get rid of 100% of them. Some of them eventually come back, and they start to grow back. It takes them about 3 months usually to do that, which is why our 3-month visit is so important on gum cleaning. That's the one where we go back in and disrupt them as much as possible. On other items that we're going to do, we're going to talk about things like hydroflossers, medications, things like Listerine, rinses, hydrogen peroxide, all kinds of things like that basically just make life as miserable as possible for these little bacteria as we can. Another treatment that's showing a lot of very good promise is using lasers, where we go in and we actually treat that pocket with the laser beam, and it kind of zaps the bugs. And it also has a second effect that it really helps to stimulate your gum to help to heal and help it react better. Those are all very palpable items that we use in deep cleaning. So I hope this was helpful, and if it was, you can reach my office at the number that's listed on the bottom of the video or at our website, and we look forward to hearing from you if you have any questions. Thank you.